gonna. Would that change anything? Oh,
There.
what did I do?
Good afternoon, everyone.
Hello.
Good afternoon. Katie, you look like you was trying to rest.
I could go for a nap. I'm not gonna lie, Commissioner.
You know, I'm not used to connecting on Zoom, so I never know if my background is forwarded or reversed. Is it in like the right order, or is it like mirror image where it says Colorado?
Mirror image.
All right. Let me see if I can't fix that.
In defense of you, Pedro, I do that, but on Google all the time. Like, is this right or is it wrong?
I've had it where it looked like it was right side up for me, and then folks are telling me your thing is backwards, and so I've been confused ever since.
I know we're right at time. I'm just gonna give folks a minute, but state friends, if you just want to keep an eye out and let me know if there's anyone from the state side we should be waiting on before we start.
Hi, we have Michelle Barnes here, and I'm working on changing it from Shelley Baker to Michelle.
That's fine, we're both here. I'm sure we will see Kim here momentarily.
Okay. I don't want to. Just to
Who's Director Ben Staffer? Right, I think we're looking good from the county side. CDHS, HCPF, anybody we should be waiting on?
I think we're good.
Okay. Well, yeah, thanks. Thank you, CDHS and HCPF partners, for being here and talking to us about everyone's favorite topic, CBMS. See, Nora should have screen sharing ability, but I will just, without further ado, hand it over to you all.
Sounds good. Michelle's going to kick us off. Josh, are you sharing?
I was just about to ask. I think Nicole is sharing, and she just started.
Michelle, you up?
You guys hear me okay? Can I get a thumbs up? Okay, thanks, Kim. Okay, thank you for inviting us today. This is a treat. We don't often get to speak to as many commissioners as wanted, particularly about something as important as CBMS. So today it's myself, I'm the head of human services, and my colleague Kim Bimstepper, who's the head of healthcare policy and financing. I'm joined by our deputy executive director, Pedro Alameda, who oversees many things in our department, including technology, and Ralph, who is the chief operations officer at CDHS. So we can go to the next slide. So what we're doing today, we understand that we were asked to come and answer some questions. So we aren't doing an overview of CBMS. You had a lot of questions. We want to take a lot more questions. So we're going to specifically focus on answering your questions. I will also like to invite you to add questions into the chat, and we can answer them real time as we go. So we're not waiting, and then any of them we don't get to, we'll answer after we go through. We're going to take about 15 minutes to go through our slides. The point for us is to give you answers to the questions and then give plenty of time for dialogue. So these are the slides, the questions that came over from CCI. Definitely focusing on priorities. I'm not going to read the slide, you guys can see it. How do budget and resourcing works? How is county feedback taken through the ESC? And I hope your 2 ESC members are on this call. How do we get to where we are today with a patchwork of vendor services? Asking questions about CBMS dashboards, and why don't we use SLAs? So with that, I'm going to pass to next slide. I'm going to say before I pass to Kim on this, I also want to frame the conversation. We're hoping that this is a good collaborative discussion. We're coming from a perspective, there's no us versus them. There's no county versus state. There's no HCPF versus CDHS. There's no feds versus states. Like, we all want and need CBMS to be successful. So we have no ulterior motives. We have no joy in the system being down for you. We have absolutely no hidden agenda. So I hope over the next 15 minutes, you'll see that we're trying to be really transparent and ask you to do the same and assume best intentions. With that, Kim, can you cover the?
Yep. Thanks, Michelle. And thank you for giving us this opportunity. Truly appreciate it. For those I haven't met, awesome to meet you. Looking forward to awesome collaboration. So you asked, or we want to discuss just general county collaboration, because the CBMS is one area, but I wanted to underscore and sort of kick us off with how important some of the initiatives are that we've been working really hard on with you, that we all get behind. So I want to hit the first one first. 22-235 is a collaborative effort between the counties, HCPF, and CDHS, and it helps you get the funding that you need. So here's our ask. Don't let anything distract us from all working together to get you the funding that you need. Here are some of the things that it does. It says, you all said you needed to be able to fund through us so that you can hire people no less than $55,000. That's what it does. It says, you said you wanted more voice in the things that get done, that sometimes the stuff that you want to get done gets thrown off the list. It's because we don't have enough pull hours. It increases the pull hours that we have to actually do work by 60,000. You said it's really hard for us to look through all this data and have everybody know everything. It gives some artificial intelligence so you can click into a system and it gives back your county worker the answer to the difficult questions that they need to know. It automates lots of their things. It brings next generation technology. So my ask is, please don't let anything distract anybody saying, how about new this, new that? Get behind this, because it's your voice that's coming through the folks that have the voice on the committees that we work on together in collaboration. This report goes to the administrator or to the legislature in November, and it needs to be in the governor's budget. It needs to be in Michelle's and my budget. We can't talk about budgets till we're allowed to. Please, everybody get behind this. It's giving you what you needed. Your voice has been heard and it's coming through it. The reports come out in November. Next item, you asked us to reduce the county workload. Really important. It's a governor's wildly important goal. That's the highest level of goals that the administration has. So we put it first. I'm held accountable to helping you get to the right levels of peak performance, members tools that get you the data to be able to process eligibility, and also the automation. So we were not getting enough information or enough renewals automated for you, which made the work for the county workers so much harder. We've now gotten, in the month of June, 66 to 67% of your renewals are automated. A human doesn't have to touch it either on the member side or the county processor side. So we are committing to making sure this automation is top priority. It's the highest level now. Why? Because you asked it to be. Correspondence as well. Doesn't do us any good to send out crappy correspondence and you get questions because the correspondence came out from CBMS is crap. We've rewritten the letters. We'll finish them by the end of the year. Really important work. Full transparency. We should have had you more actively involved in this. And the CDHS, our fault. Point of learning, transparency. Very good. JAI, you have been in collaboration with the departments to make sure that together over the last 3 years, we have a vision together for a shared unified document capture and a shared work management. All of that has been worked on. Counties have a vote. It's all going through. Very excited over the next few years to move that through. And the last one is CBMS should be a shared tool that we all have a voice in. Right now, we're doing the work, commitment from us. By the end of this fiscal year, we have a shared vision for CBMS, and that's really important because it's going to bid right now. So you are actively involved with the departments on these things. We need to make sure that as we work together, the folks on these various committees are doing a good job of communicating to all of you so you see the voice and we're all aligned to get you the funding and the services that you need. Thank you very much. Let's go on to the next slide.
And good afternoon, everyone. My name is Pedro Almeida. I'm a Deputy Executive Director for Michelle Barnes for Administrative Solutions at CDHS. And the first thing I'm going to cover here, the governance structure that we have for CBMS and how county feedback through the Executive Steering Committee is received and prioritized. The first thing I'm going to do is show you this organizational chart that we have here. At the top is the Executive Steering Committee. It is fed into from that work plan subcommittee in the middle, and that in turn is fed by a number of integrated program teams, which you see a number listed along the bottom of the slide. The boxes that you see there in blue have county seats that are designated as part of those systems and those processes. What I will tell you is that, first of all, we have an understanding that we need to improve this process. We need to improve the discipline by which we execute with it. We need to improve the way and the transparency and the processes that we have in place. And we need to make sure that that county voice is well represented. Obviously, we have the seats that are already designated within these systems, but how we're executing that and doing that with better process is something that we are diligently and very much committed to right now. This ties back into what Kim was just covering, as she mentioned at the very last comment on the previous slide about strategy and vision, and we will continue to go ahead and focus on those. We are in the process right now of engaging with county partners as well as within the state on how we're going to improve and review the charters for each one of these subgroups, each one of these sections, make sure that the charters reflect what we actually need them to reflect in terms of how we're doing it, and then commit to rolling up our sleeves in conjunction with the counties and how we're going to turn around and execute this process to be as effective as possible. We need to have a seamless, transparent system. It is a complex process that we are working to manage with the ESC and answering to the ESC, and making sure that we have the right voices plugged in at the right places is what we are very committed to do. And that's why we're doing that charter review right now. And we have county voices that are part of that process. With that said, let me go ahead and we'll roll on to the next slide, and let me hand this one over.
Thanks, Pedro. Good afternoon again. My name is Ralph Choate. I'm the Chief Operations Officer for Healthcare Policy and Finance. Wanted to answer some of the how did we get to where we are questions regarding the CBMS system. The CBMS system is and continues to be the vision of providing a unified system approach to the variety of services that we provide to our residents across the state. It currently supports over 1.25 million Coloradans with Medicaid, almost 600,000 folks that are in SNAP, 17,000 that are in adult financial, but it is the engine that allows for a unified approach to SNAP, TANF, adult financial, Medicaid, CHIP, and many other programs. It is an eligibility engine that is built around the rule set for all of those programs in an effort to make sure that we can ask people for pieces of information at the time of their applying for one program and extend that information into others wherever possible. It is owned by the state. And one of the questions that's come up is, so is there a replacement for CBMS? And the honest answer to that is no. This is a built and crafted by the state program. There's certainly, would or could be how do we have 20 different systems with 20 different logins and 20 different look and feels, et cetera, approach to this. The state has chosen and continues to reinforce using a single system for this. That doesn't mean that it can't get better. It needs to get better, and collaborative feedback from the county folks, as well as from the users and the members, is part of a constant process as we evolve and adapt this program to meet the changing needs of Coloradans. Next slide is back to you, I think, Pedro.
Thanks, Ralph. Appreciate it. I'm not going to go into this slide in a tremendous amount of detail. The key thing that I want the audience here and all of you listening to come away with an appreciation of is that this eligibility system that we call CBMS is a living and breathing system. It is incredibly complex to the point that Ralph just pointed out on the previous slide, with the number of web pages that we have and the number of systems that we support with CBMS in the eligibility process. It is a system of systems, very complex, multiple updates as we go through it. It's been around for about 20 years. And over the span of those 20 years, you can see some of the last major updates are in the column on the right for the various tools that we have with CBMS. It is constantly being updated. We have a process built into our state systems that I showed you on the previous slide to help determine what systems get, or what parts get included, or what parts get updated on a regular basis. Some of the updates we talk about are simply technology in terms of making sure that we have the most current and reliable technology that we have. And then sometimes we have systems or processes that are updated based off of changing rules. But the key point for all of you is it is a living and breathing system, constantly going through updates. Anyone who says that CBMS today is the same CBMS that we had 10 years ago, that would not be completely accurate, because there are a lot of things that have changed in CBMS over the span of the last 10 years. Let me go ahead and hand it back over to Ralph as we get into the dashboard.
Thanks, sir. So one of the things that we've been working with the county staffs on has been conversations around downtime and slow time, and really the experience at the end user state. And one of the things we've come to realize certainly is that the information that we have had at the center points of the system does not reflect what the experience has been at the county level and at the Medicaid and human services technician level. And for that, we certainly apologize. We know that we need to work together with our county representatives to help identify a method of measuring this so that we can hold our vendors accountable. We're going to talk about SLAs a little later, and really hold the operations team of CBMS accountable. And so the good news is that we've already scheduled a meeting with a number of the county representatives. It's scheduled for the 2nd of August for us to sit down with the data people that are part of the CBMS infrastructure to make sure that we can work together to unify around a set of measures of uptime, downtime, slow time. I had an opportunity last week. I was in Denver, Castillo, Boulder, and Douglas, not in the same day, but in the same week, and got some really clear insights from the team around what they're experiencing. And I look forward to bringing that feedback as well as other experiences back to that meeting that's coming up. We do know that from a measures standpoint, Director Bimsteffer mentioned that on the Medicaid side, we've seen substantial increase in the measures around Medicaid automation and what we call ex parte, or the automatically approved renewals, with that now pushing into the 66 to 67%. You need to know that we have goals and objectives to drive that well into the 70s and beyond. So we are not done with that. And one of the things that we were discussing as we were getting ready for this was around reduced document requests for the cash programs. Those documents have reduced by half over the last 2 years, and the process continues. I was just on a call with the executive directors and with Deloitte, and we were talking about the August enhancements that are coming in that are going to bring some of that optical character recognition, the system actually reading the downloaded data and whether it's birth certificates or pay stubs or driver's license, et cetera, that starting in August, we're going to start to see even more options where the system's going to read that data and put it into the system and relieve county workers of that kind of work. So much to do. Certainly can't get that done without the collaboration of our county partners. And we're looking forward to those efforts. Pedro, I think you and I are in alternating mode today. You want to take the next slide?
Yes, sir. Jumping into the question, the specific question that was asked, why doesn't the state use service level agreements?
Hey, Pedro,
ahead,
I'm so
Katie.
sorry to interrupt, but I see we've got a hand raised. So I wonder if we should just go back real quick while we're in that zone and get Commissioner Weaver's question.
Thank you, Katie. I guess my question's for Ralph. I just want to clarify something I thought you said in the beginning, is that you guys don't see the issues that the county are advising you that they're having. Is that what you said?
No, I apologize. If that's what you heard, I apologize. What I said is that we've been looking at downtime and slow time being measured at the central hub, if you will, of the CBMS system. And what's being experienced at the counties is a different experience. I'll give you an example, because some of this is CBMS and some of it is other elements. I had an opportunity to meet with some of the folks from Castillo, and when I asked them about downtime, they commented on two topics. They said, well, one, when power goes out in town, that's downtime to us, and we're not very happy about it. Could we please have generators? And then I said to them, I said, well, are there other things other than power outages? And they talked about the fact that they were concerned and were on either their second or third internet provider for connectivity into the state systems. And so what we're learning as we're spending time is that there are unique elements along the entire delivery path of these technologies that we have to be able to get feedback on, open help desk tickets on, and learn to figure out how we help each of the individual county experiences, because they are different. As I've been spending time with the counties, different experiences, different problems. We're certainly reflecting through help desk tickets the ones that are central to the core system, but there are other elements that we believe are contributing to this in different ways in different parts of the state. Is that helpful?
Yeah, and I just want to help clarify all this for me. So I'm a Yuma County commissioner. And so if Yuma County experiences a 3-hour downtime, is the state seeing that same 3-hour downtime? Is that what you're telling me?
I would say that the answer to that is perhaps, because the downtime may or may not be availability of the core system. It could be something in the connectivities between Yuma County and the state network. So what I'm learning, and I'm having a great experience being out amongst the counties in my travels, is that it all kind of gets lumped into, we can't get to CBMS. That's a true statement, but we need to do a better job of working with the counties and on the help tickets to get to the root cause of why that particular county is having that particular experience at that time, at that day. And that's something we need to continue to do a better job at.
Okay, so then at that point, you're going to try to figure out, okay, is it our core system? Is it the connectivity between the systems?
Right.
Okay.
Right. Yeah, absolutely. And we need to do a better job of that kind of diagnostic work in certainly, I think, in all of our estimation.
Okay, that helps me get to where I need to be right now. Thank you.
Thank you.
And Commissioner Weaver, if I can add on top of the things that Ralph just added there, the complexity of the question is significant because it is a system of systems. And to reiterate what Ralph said, completely agree. From a worker perspective, the CBMS is not working at their desk. But what's behind that and what is causing that, number one, could be a central issue, could be a decentralized issue, could be a localized issue. That's one thing we have to work to figure out. Another thing we have to work to figure out is the impacts. And this is one of the things that we are trying to get a better handle on across the state in terms of how we're measuring those impacts at the county level. And that in and of itself is a very complex question as well, because we have 64 counties. So even if it is a centralized issue that happens across the state, how it impacts Yuma County might be a little bit different than how it impacts Mesa County, depending on the system the system issue that we're dealing with. So there's multiple layers of the complexity that are here that we continue to work to improve, and we're very focused on doing that right now.
Okay, thank you.
I'm going to, unless there's another hand, I'm going to transition to the next slide when it comes to the question of the state use of service level agreements. This was a specific question about why don't we have service level agreements? We actually do. The primary contractor for CBMS is Deloitte. We actually have 22 service level agreements that we work with them. And when we say service level agreements, it means that these are standards of performance that we expect the contractor to deliver. They have a standard. They're not hitting that standard of producing X amount of service or producing X amount of standards and meeting those standards, then there is a penalty that happens with them in some form or fashion. We do hold the vendors accountable for the work that they are doing through those service level agreements. We certainly have those also with Salesforce. And our job and our intent is to continue to maintain the right service level agreements to make sure that we are holding the vendors accountable. It is a system of systems as we look across the board. There are multiple vendors that are involved, many vendors that are involved with CBMS. And so maintaining the right level of focus on those different systems is a complex challenge in and of itself. But the primary one with Deloitte for certain has service level agreements that are very much in effect. And then we do monitor those every single month. And we get reports on those every single month. If we do have an issue that happens across and that affects the performance of CBMS, in order to hold that accountability, the first thing that we do is that we work and we focus on getting the system and the issue resolved as quickly as possible. Once the system is back up and operable, then we follow that up with a root cause analysis to go back and take a look at all parties that are involved. It could be Deloitte, it could be a vendor downstream for an associated system that's plugging into CBMS. And we go back and we do a root cause analysis and we look to determine why that system went down or why we had an issue. And sometimes that can be a very complex exploration in and of itself, but that's something that we're very dedicated to, and we do that every time we have an issue with CBMS. We'll go ahead and go to the next slide, please. And I think I'm handing this one back over to Kim.
Yeah, Commissioner Scott, I'm going to bring us home and then call on your question there. So, again, we really appreciate this time and the partnership. I want to just be extraordinarily transparent. Our hair's been on fire for the last few years. We had a global pandemic that killed people, right? It attacked people and it attacked people that we're serving. You were having issues with folks trying to get to work in a pandemic, folks having to move work at home. So we want to underscore and recognize that some of the things that we've done got a little loose, and how we were in collaboration, how we're in partnership, because that's what happens sometimes when you're in a crisis. So A, we want to apologize for it. B, we want to double down on making sure we have discipline around things like governance and infrastructure. So in closing, I want to say it is really important that we all get behind the areas that we have been working together collaboratively, counties, CDHS, HCPF, to get you the resources you need. Commissioner Scott James from Weld, you asked the question in the chat, how does this get funded this long term? It is critical, right? So the answer is it has to be in Michelle and I's budget. So we can't talk about budgets till we're allowed to. Michelle and I's budget rolls into the governor's budget. So we are on point to memorialize what is in that report that comes in November, do the best we can to get the resources. Here's the truth. There is not a lot of money in this next year's budget. So when I say we all have to get behind, and we say get behind this, because there's going to be a ton of people jumping up and down in front of those elected officials at that Capitol to get what they need, we need to be aligned to get what you need. And you may have heard me say that in the June 20th testimony before the JBC, and you probably heard me say it before the Technology Committee in this past month, or earlier this month. So please, let's get behind this because it gets you what you need. On the second part, you have our commitment, Michelle and mine and our teams, to collaborating better with you as we come out of some of the just really difficulties. I'll admit, CDHS and SNAP are still in huge difficulties. Our vision's getting a little better because we've lost so many members because of the end of the public health emergency and going back to business as usual. So as we do this, what is the commitment? CBMS transparency and inclusion to make better decisions together, better shared performance dashboards. We have a lot of that in the executive steering committee, but we can do better. advancing the governance systems to go back to the discipline and to recognize where we have opportunities. And my ask and our ask is keep issues small. You know, my door is always open. I know a ton of you personally. Raise your hand, send me an email, do the same to Michelle when things are upsetting you. To the point, this is not us and them. This is all of us together trying to get you what you need. If you're upset with something, raise your hand, ask the representative sitting on the ESC to put it on the agenda. Send Michelle and I an email to make sure it gets on that agenda, and we're helping you get what you need. And we appreciate that, especially in tight times of budget, that we're doing everything we can through the governance and doing everything we can to get without asking for additional resources in addition to number one. And the last, again, this last few years have been really hard. I personally, and on behalf of the state, thank you for your collaboration. It's been hard, and we're working hard to get you what you need. Where we fell down, mea culpa, let's get a new tomorrow. Here we go. And Commissioner Scott, I'll open it up to you.
Thank you, both Director Bimsteffer and Director Barnes. We certainly appreciate the open conversation. We do. Thank you. Since I have been on the CBMS ESC, I've sensed a level of frustration, and we have a tendency to do this a little bit, to point at one another when we talk about frustration. I agree with you that we need to make sure that we are on the same page and the same team. So a very wise person once told me that frustration is nothing more than an unmet expectation. So I think perhaps that we ought to get together and have a conversation about our mutual expectations and make sure that those expectations are met amongst ourselves, so we can go forward into the state legislature with that unified front that we'll need to present when it comes to continuing to make sure that CBMS runs efficiently. I do have a couple of questions that are specific in nature that might be Ralph, might be Pedro. We're curious about the slowness issue. We appreciate the fact that since the one big weekend where everybody was down, that we have had some pretty steady uptime, but there has been a slow time, which is, I realize that can be subjective in any link along the chain. That could be at the local user, that could be at the ISP, but we hear this conversation a lot about slowness kind of around the state. Talk to me about slowness, about how it's monitored, about how it's logged. And then a really specific question. Our director of IT here at Weld County pointed out the fact that in the month of June, we had nearly 1 terabyte of data going out with a piece of logging software that was apparently underlying CBMS. Can you comment on that?
Ralph, do you want to take that?
Well, Commissioner, thank you for the insight. I'd love to get the rest of the story if you wrote the rest of the details to that, because 1 terabyte of data is not an element that I'm familiar with. I do know that one of the things that we're going to need to work together on is going to be partnering around making sure that these events are being accompanied by help desk tickets and not any level of acceptance, right? One of the things that, we were talking about SLAs earlier. One of the tools that we have that helps us hold any of these vendors to a level of accountability is being able to make sure that we've got good documentation of what was happening at the local user level. And so, I think, that's kind of the go forward piece, but I'm happy to get from your IT folks, unless Pedro, you're aware of a terabyte activity. Both of us can work on it if we can get that information from your IT folks.
Yeah, Ralph, I can, in fact, I'll connect you and our IT director by an email, and you guys can talk geek with one another, because we're running into one of these, and I think that's just to acknowledge that you guys, Pedro and Ralph, you get so down into the weeds as you need to on these complex systems. And for most of us, it works or it doesn't. So let's have that conversation about making sure that we understand what is and is not working, the SLAs and how you interact with them, and make sure that we as a group of users are enforcing those SLAs. And I want to talk a little bit about communication as far as when there are known issues, how quickly you can communicate with the counties, with the users on what we might expect, and then how long the downtime might be.
If I could tackle a little bit more response, Commissioner, with your question on LogRocket and the Weld County piece. That was a discussion that was going back and forth for sure between the CBMS team and Weld County. back in June. I thought it was already resolved. I'm not sure if it is still an issue, then we will come back and re-engage on that question. And the question at bottom line is LogRocket, and I'm looking at some notes that I have over here. It's a tool that helps collect information on end user activity. It's something that we normally use. There was an increased bandwidth in terms of what was coming with LogRocket because there was an upgrade that activated the LogRocket system. So all of a sudden it was demanding more data. I'm under the impression, and I was under the thought back in June that tweak had taken place within the LogRocket system, and therefore that flow of information, that flow of data was reduced dramatically since then. I do need to go ahead and verify and get an update on that, but that's what was behind that. It wasn't anything that was nefarious, because that was one of the questions that had first came up from the team was, hey, all this data is flowing out. Is someone sucking the data out? It had to do with an upgrade on the LogRocket system that had taken place back then. That's what I understood back in June. I have not had an update on that in the last 3 or 4 weeks, but we can certainly follow up on that, make sure I didn't give you something that was incorrect.
Pedro, Ryan, our IT director, said it is not something that's occurred over the last few weeks, that it was something that was isolated to June. And I realize it's not nefarious. That's not an intention in communication at all. He just thought it was interesting in the fact that the reason that the data transfer was so high is it was taking screenshot images as opposed to a textual kind of a logger. And he just, it showed up on our top 5 traffics. And so therefore it kind of rose to his level.
I'll jump
Lexi,
in
you
with
want to
my
do your
question.
thing? Yeah.
So, you know, as you all know, the counties generally identify their budget priorities. CCI submits material both to you all and to the Joint Budget Committee. And always on that list is sort of funding to stabilize and enhance CBMS. But we don't often know more details about what you all need in order to truly do that. And so earlier in the very beginning of this presentation today, you mentioned, for instance, funding for more pool hours. I'm curious if you have a sense, both HCPF and CDHS, of what, not just how much it would cost, but what you would want to sort of where you would want to direct funding to both stabilize and enhance CBMS. Because my guess is, I can't speak for all counties, but I'm sure at least individual counties would want to support you all in that effort. Is it pool hours? Is it something else?
I think it's a host of things. It should be transparent in the report that we're writing together that's due in November. And maybe we set up a separate meeting with a smaller group to go through and make sure that is in the right place. Because what I said to the human services directors is that, you know, I've said to the team, throw the kitchen sink at this, because we're not going to get another bite at the apple for a while. And so we're a little bit disjointed because I'm saying throw more in. And again, I can't talk about budgets, so we talk about budgets, but the intention is some of the pool hours, like 60,000 is what we're looking at. What I said on mic, so I'll say it here, I don't want to have to look you in the eye, representatives, and tell you, you have to wait 3 years before we can implement a bill which you passed. So we've got to have a process where we catch up on the backlog that's built. And a lot of it was built because the federal government kept stepping in and saying, no, all you states, you now got to do this. And these waivers put in. So we got a little backed up because of those things as a state, because of the public health emergency. So we need to catch up from the backlog. And then we need to have enough long-term increase in resources. It's not just the pool hours. It's when you have a project, you need a business analyst to actually translate what's needed into the system. Then you need testers to make sure that what you're about to go live, it goes live correctly. Plus you need pool hours for Deloitte to build whatever it is in the system. So there's this infrastructure around, and it's that, Lexi, that is sitting inside this long-term county trying to get us to altitude, if you will. And so we need to have a little bit more transparency of what is needed. And I need to separate that along with Michelle from budgets, because we just are not allowed to talk about it until we are. It's the governor's budget. But know that you got a friend and we're fighting like hell. And Michelle and I have made it known this must be a priority. Then we just have a real hard budget year and we'll have to figure that out. But let's make sure we're all aligned around what's in that report and that we are all standing shoulder to shoulder and lobbying the heck out of that to those under the dome. Does that answer your question about sort of the process and what we're trying to do?
I think so. And I very much appreciate that you can't talk about your budget asks, but as we put together material for our budget priorities, we want to be aligned in what it would actually take to improve the system and stabilize the system. And then secondly, yes to the 235 report, and my hope would be that we could find a way to be working together on what that looks like sooner than later, since November is going to come quickly.
Yep. I think Josh is on point. Josh, you want to address that quick on timing and making sure we're all aligned?
Yeah, Lexi, that's actually an agenda item for our Friday afternoon meeting. So we're going to go in depth about the final report, the draft outline, that sort of stuff. And that way we can all get on the same page around that piece.
I think, Lexi, Michelle and I will take away, how do we talk about what we're not allowed to talk about? How do we talk about what it costs to do something? And then, anyway, so Michelle, is that your hand? Do you want to address this? Or
It is, yeah. Let me just jump in if you start. I will also say I'm using every opportunity I can to say Kim and I already have our budgets finalized for the fiscal year starting 2025. So if you're working on priorities of things you want us to put in the budget, we need to hear from you back like in March or April. So I know that we go through this every year, but just so you know our timing, we submit our budget in July to the governor's office. He announces his budget in November. So we're already, any new things you give us, we're talking about the budget for the year after that, 3 years. 3 years. So just being really clear on timing. Pedro, do you want to add to it?
And just, sorry, Director Barnes, to jump in on the budget. I think Lexi has been in touch with Christina about kind of some very preemptive initial, not a ton of meat on the bones, what our priorities would be. And I think they're, 235 funding, the child welfare workload funding, things of that nature. They probably will not surprise you. But we haven't put together that formal package.
Katie, I'm just going to say, I didn't see it. And it's not in I didn't get your input before I had to submit my budget. So if you guys want to be part of influencing our budget, we need you to do it in the spring.
Okay. And let me clarify that. You have already been really vocal on what you want, and it's represented in 235, in the pull hours, in the modernization, in trying all the automation. So a ton of what you've said through the ESC and all of the meetings we've had, it's in there. Again, we can't talk about it. It's the additional things that you sort of want to do that we don't know about, that we haven't been able to address.
Okay. And I'll connect with Christina maybe on that too, Michelle or Director Barnes.
Thank you. Pedro.
Going back to the, as we talk about this question of what needs to be done to stabilize CBMS, I want to bring a little bit of perspective back to the organization chart we showed and the governance process we showed, and the point I made earlier about this being a living and breathing system. I want to make sure that we have a very clear understanding as we look across the board that CBMS is constantly in need and will always be in need of continued revision, updates, and system changes. This is something that's reflected in all the updates that we've had over the span of the last the last 10 years. And we will continue to have those as we go forward. Making sure that we're focusing on the right things goes back to that governance process that we showed earlier. And we need to make sure that we have the county involvement, going back to the point of transparency, and doing that the right way. I don't think we have been doing it effectively. I think we have strayed from some of the systems and the processes that we have. The infrastructure is solid in terms of what we have built. The execution of it is where we need to have a lot more discipline and a lot more focus to make sure we're doing it the right way. As we talk about that governance process, there are places that are built into it to make sure that we have county input, as well as we have state program input, to make sure that we are building and focusing on the right things, as well as the technology input from vendors like Deloitte on the things that their recommendations on things that we need to do. But all of that should be coming into a governance process that is clear, that is transparent, that we understand, and that we are sharing the priorities and we're focusing on the right things. And if we have that process built and we're following it with discipline, we will continue to address any kind of changes that need to take place in CBMS to identify what technology patch needs to be done or what upgrade needs to get done. We have to come back to that governance process as a baseline for long-term success.
Hey, Pedro, can you just keep the microphone here and answer Commissioner Tamara Pogue's question? She said, I appreciate the efforts. I wonder if there might be some way for counties to communicate outages directly until we can work together to figure this out.
Absolutely. Commissioner, thank you for your question. We do have a process that once we have an outage, it kicks into a whole lot of communication that has taken place across the state on multiple levels. There is a technology side of this that's happening within group chats that's including OIT, because depending on what the issue is, OIT is deeply involved in the technical issue. If it is something having to do with something like, for example, a cybersecurity attack, we have to be somewhat cautious and follow guidance and get support with OIT in terms of what we can release when, as we're trying to gather some of that information. But at the same time, when we're working those technical discussions, we are also communicating directly with the counties via the communications chats and groups that we have an outage, and we're constantly pushing those updates out there. It is a beast, to put it mildly. I have lived in the world of emergency communications in large organizations for a long time. We have some of the same challenges that you have in any large organization. I worked in a school district. It was the same thing. How do you get the right information to the right people all the time when the thing is happening really fast? It is a constant challenge that we constantly work at, but I can tell you that we are very, very diligent in pushing out the information that we can as fast as we can. And we do that on multiple channels and multiple chains. I think Commissioner James had his hand up next, and then Commissioner Weaver.
Thanks, Pedro. I'm sorry. I'm just looking real quick because Josh might have answered a question just now in the chat, and I appreciate Josh's answer there. Hey, let me just say, as a ESC member, I appreciate the more frequent meeting schedule, because I do think we need to have those conversations every couple of weeks. I also appreciate the desire to work together in partnership. I think it does begin in that governance structure. We have to quantify that. We have to adhere to it. And we do have to work as partners, because I recognize that, we might go back and forth with one another on ESC meetings one time. The true battle or challenge, however you may see it, is in the legislature with funding, getting them to stick to 235 and other endeavors as well. So thanks for that. Director Bimsteffer, I would be greatly appreciative, though. When you use a shoulder-to-shoulder reference, the CSU Ram in me bristles. Keep that shoulder-to-shoulder reference to Senator Kirkmeyer when you go to the JBC. But that's it. I appreciate the conversation.
You got it.
I have a question. I want to say first, thank you for this. I appreciate it. I appreciate the wanting to have transparency in all of this. I do have a question. It may end up being a couple questions. We have heard multiple times that the system's antiquated. We need to upgrade. We need to spend all kinds of money. But until today, I didn't even know that we had SLAs. And so to me, there's a lot that could probably be done with those SLAs. And I guess my first question is, has it always been that you've had SLAs and that you've held those people accountable with those SLAs? That's probably the first part of that question. The second part of that question is, if it's not an antiquated system, maybe if we're more stringent with our SLAs and holding those people accountable in the processes that they need to be providing, maybe we don't need to spend a whole bunch of money. But going back, if it's antiquated, then we need to be looking at that. So I think from my perspective, I need to know which way, what do we need to do? Do we just need to hold people more accountable, or do we need money?
I'm going to take the first crack and then turn over to Pedro and Ralph. So it's a little bit of combination of both. The system is not antiquated. It's built on a reasonable technology, and the front end Salesforce is very modern. The Amazon Web Services is a cloud-based data system that's very modern. But some of the rules and technology, the way that you interact with it, we have opportunity. And the artificial intelligence new technology can make it much easier for the county workers. And that's where we're sort of focused. So that's where the money comes in. And the money is where we need to have more pull hours to get more things built for you. To your question on the service level agreements, there was a period of time when OIT was running the business side, and that's really hard for a technology organization to run healthcare or SNAP and all the unusual. So Michelle and I came in and said, we're going to own the business part. And we took Deloitte, which was sort of running the engine, and it was sort of backwards. Deloitte was calling the shots because OIT didn't have the business ownership expertise. So Michelle and I reversed that, and it got really hot that there was a 6 months renegotiation. The peak tools were not working the way they needed. So we took savings in the first year, about $6 million, and pushed them into peak just to get us caught up to the year 2010. So that's the money part comes in. So let me finish this thought. The SLAs, Michelle and I renegotiated and got them much better, but it still wasn't good enough. We continued to negotiate with Deloitte to get things tighter. So an example, I think we have more room with Deloitte to have better financial penalties because the amount of time that they have in the SLAs for the system to be allowed to be down is not good enough. It's a place where we need to get back to the table and hold them more accountable so they feel this pinch in the money as much as you feel the pain. And so much better as recently as right now, renegotiating some of the areas around correspondence to make sure. So I'll turn it over to Ralph, but just know they weren't as strong as they are now historically. We need to continue to move them. Michelle and I got them stronger. Ralph took point, Pedro's. We've continued to drive them. We need to continue, but there's some big guys, too big to fail, like Salesforce, much harder to deal with, to do a service level agreement where we might want it to be versus say a Deloitte. Ralph, Pedro, please. You're on
Ralph,
mute.
muted.
I wanted to reiterate that as recent as last week, we were making updates to SLAs in parts of the business, and actually conversations today that I believe are going to be the genesis of at what point do the Deloitte people have to get in their car and drive to the counties to see what's happening? It was actually part of the conversation we were having today. I suggested Castillo. They wanted Denver. I think we'll find an answer somewhere in the middle, but you get the idea. The other thing I wanted to just make sure that you all know from a standpoint of antiquated and keeping it up to date, both in federal and state stature, we have to go back to rebid these contracts every 10 years or so. And we're in the midst of that process right now. And y'all are in it with us. I think if you talk to Jamie, she would tell you that we've asked for and gotten names for folks to participate in the reprocurement process. So to be able to sit with us at the table with whomever is going to bid for the next decade's worth of control on these systems, and to ask pointed questions to make sure that the specifications that y'all would see as important are part of those RFP documents. So we're very excited about the partnership as it's going to apply to not only ensuring that we get better vendors, but they get better standards. And we've already started talking about what kind of SLAs would come with signing the next contract that starts next year or the year after. So these are all active conversations, and it's good to know that we can count on y'all's voice supporting those expectations. So hope that helps.
Did we get to all the questions that were in the chat? I saw a lot of answers going on. And Pedro, do you have your hand raised, or is that from before?
It is from before, and I'm putting it down.
We're happy to take any other questions, even if we just say we'll look into it and come back to you. Jamie.
Hello. I may have missed this. I apologize, Pedro, but did you give a time frame for the governance? I know we're currently working on updating the governance structure and looking at charters. Have you provided that time frame for when we're hoping to be completed with that work?
I am make sure I'm not muted here. I am pretty sure that we are looking at the next few months on completion of that. But Nicole, I think you may have the most current schedule if you have a very brief end date on when we're looking at the charter revisions and the schedule that you have laid out.
Yes. Hi all. For those of you who don't know me, my name is Nicole Duran-Jones, and I am the Deputy CBMS Product Director. Jamie, thank you for your question. We do have some timelines that we've presented at ESC and have provided through 2 newsletters, one that gets sent out through CBMS Communications and one that gets sent out through CHSDA. The timeline that we're estimating right now, and I'll get another update out to y'all here soon, now that it's almost the end of July. But we're aiming for the September 12th ESC to review those documents, but you all will receive, our ESC members will receive these documents at least 2 weeks prior for review. And then those folks who are sitting on those groups should also have copies of those drafts as they're working on them as well. Does that help? Okay.
Thank you, Nicole.
There's a question in the chat that I'll just take a shot at. No, Commissioner, we did not say that the SLAs will be like 10 years before they're evaluated again. We bring the vendors back to the table when we have issues. And most of them are pretty collaborative. Salesforce, just a little difficult because they're huge and you sort of do it their way. And we're doing the best we can by going through OIT, who has a big contract with them. So all of the state's contracts going through one. But that's why we're referenced just even this past July, and now we're updating, and Deloitte's been under contract with us for many years and we're still updating SLA. So when something has us upset, raise your hand and we bring it back to the table. Commissioner Scott, James?
Thank you. Just a quick question, irrespective of our time, about Peak Pro licenses. I thought I heard some chatter out there about Peak Pro licenses being put on hold. If that's the case, when will we start reissuing those, and when can training go out to the providers? If somebody care to comment on that, please.
I don't know that we have an answer on that. Ralph or Pedro or Josh, do you have an answer on that?
Yeah, I believe, and correct me if I'm wrong, I think I was chatting with Jamie about this. This actually has to do with 2 external agencies. One has to do with the BHA build that went into CBMS, and then the second is the case management agencies getting access to Peak Pro. And that in both of those instances, those provider types are reaching out to the County Human Services Department to get those provisioned, which is driving up their call volume, and conversely driving down their ASA, or driving up their ASA. I do think, though, we did check in with Mike. I think there was some progress on that on the BHA side. I would have to follow up on the CMA side. Jamie, did I get that correct?
Partially, yes.
Okay.
Thanks,
At least
Josh.
it was
So
partially.
the BHA and the CMA, but also we have other providers that are maybe certified application sites, or other medical sites that are seeking access to Peak Pro as well, so that they can submit applications to counties on behalf of the clients. And our understanding is that they are under the impression that all licenses have been put on hold temporarily. And when you first started the presentation, Director Benfister, you talked about the reducing the county workload, and part of that was Peak Pro, and certainly ensuring that those providers have licenses to Peak Pro would really help reduce the county workload. So just wondering if there's any validity behind the information that we're receiving, that those licenses are on hold right now, and if so, a timeline for releasing that hold, or what that looks like moving forward.
So Josh, why don't we take those a takeaway and get some specifics and timelines?
I will say, Jamie, I think that is also tied to a desire by certain providers to become certified application assistance sites. So that may be tied to the Peak Pro license issue, is that we're not going to issue a Peak Pro license until they are certified to do that function, and that certification happens by the department. So I would highly recommend that if anybody's hearing from providers that that's the path they want to go down, point them to HCPF. I'm happy to send a follow-up email with the contact information on how to become a certified application assistance site. They would have to go through that process in order to help the member complete the application. Like we just, we don't let random people help complete the applications. They do have to go through some formalized training in order to make sure that the product that you counties get at the end is actually the completed application and they didn't do anything wrong that would drive up your error rate. So I can send that as a follow-up.
Well, sensing the lull in the conversation, I want to just thank everybody for their time and for joining this meeting and giving good feedback and asking good questions. We will continue these meetings and conversations and ongoing follow-up. So thank you very much. And I think Katie had put in the chat that we've got a meeting on August 12th at 11 o'clock. So we'll make sure that's on everyone's calendars as well. If there's anything that CCI can do as a convening body to help with these meetings, please don't hesitate to reach out. I'm happy to put things together. And really thank you all for your time.
We appreciate it. Thanks for the partnership. Thanks for the time today. Truly
Thank you.
valuable.
Have a
Thank you.
great afternoon all.
You too. Bye-bye.
Bye-bye.